So I'm going to show you guys something. This is a program before Obamacare came into effect for the Harris County. Harris County is in the Houston area. And this is a system that was for Harris County and Galveston County. And it was called a Gold Card program. And people basically got almost free health care. This was before Obamacare came in. Uh, I think to go see a doctor, you had to pay $5, and for each prescription you got, you had to pay $3 for that. But then it went up to right before Obamacare started taking place, you had to pay $10 to see a doctor, and I think you had to pay $7, $5 or $7 for the prescription. Now, in the statement, it says this is not free health care, but it was. Uh, if you look at the top part, it says for low and no income people. But it says, but the Harris County health system is not free. Well, it is free in a way, almost free. You didn't pay premiums. You didn't pay monthly premiums or nothing. All you did is you paid $10 to the doctor and then $7 for your prescription, and that's basically what you took care of. Now, this program was paid for the Harris County uh, taxpayers. Uh, this was part of the taxes we paid. Now, this program was a lot better than Obamacare because now you have to pay for insurance carrier, and you have to pay premium. I think it's what is it, bi-quarterly or monthly fee to have health care. Okay, now Obamacare is kind of different. I think my mother-in-law pays almost 150, but I don't know if that's monthly or what. She also has to pay to see the doctor. I think it's like $50 to see the doctor, and the prescription was pretty high. But we took her off Obamacare and got her back on the Gold Card program because we talked to someone else, and they said that she should never been put on Obamacare, which a lot of these people did not understand that some of them was to be put on Obamacare and some got this. Now, the Harris County Health Gold Card, originally when it started, was helping 10% of the poor in Harris County. And that covered basically your homeless people, uh, elderly women, or the elderly, uh, and people that could not work because they're blind or they do not have limbs to go to work, basically, is what this program was for. But after people got word of this, all over Texas was coming to Harris County and visiting family members to be seen at the two hospitals for the healthcare system for the Harris County. So we were getting people from up Dallas all the way to Corpus, all the way to El Paso, coming to Harris County, staying with friends while they are visiting a hospital, which is putting a strain on the system. Uh, a lot of times, people that came was people that they couldn't afford regular health coverage because the premiums were too high. Uh, Basically, that was it. And okay, Obamacare came in. Well, they brought down the prices for the regular health care for people to pay, what is it, yearly, monthly, or something like that. And they got a lot of people put on this and everything. Well, Harris County stopped seeing a lot of people then, and it went back down to the 10% people, which is a good thing. But Obamacare, well, under Obamacare, a lot of people was not getting the problem fixed, but they were given a bunch of medication, pills and stuff. Now, this does not help the people that has a health problem. It's just a band-aid, and that's what Obama care is really about. It's not about fixing the people. It's more about how much prescriptions can we give these people, and the pharmaceutical people were making money off of Obamacare. They still are, because if you're under Obamacare, they really don't want to fix the problem. They just want to give you the medicine, and then the money for the medicine will be passed down to the pharmaceutical companies, manufacturer factories, or whatever you want to call them. So I'm going to show you this right here, and I hope you enjoy it because it'll answer that the Gold Card program was a lot better than Obamacare, and you'll see it in the store. Okay, before Obamacare came into play and everything, in Harris County, in the Houston area, which is Harris County, they had a Gold Card program, as you can see right here. And if you don't believe me, you can search it on your search thing. But the Harris County system, previously called the Gold Card, it's not in play no more. But the Gold Card, called the Gold Card, helps people with low or no income get quality health care. Okay, I want you to read this again. Help people with low or no income get quality health care. Now, this was before Obamacare came into effect, but you didn't have to pay money. You didn't have to pay insurance premiums, but when you do go look at the doctor, you had to pay like $5 to see a doctor. Probably $3. Well, it started off with $1 for 1 month's prescription per prescription, but it wound up to $3 per prescription later. But uh, if you are uninsured, the Harris Health System is a way for you to find affordable sliding scale health care. The Harris Health System is not free. Now, I want to show you guys something. They're saying they were not free, but the fact of it, they were free. Uh, People with low income or no income. Remember this up here? But down here it said wasn't free. It was free. Uh, the state uh, the state is the one that gave the money to them, and I think they went for federal grants to pay off financial stuff, and they also got support within the community to help pay for this. It was okay. The whole system was okay, but then it came along Obama, and he changed a lot of stuff, and they canceled this program. Okay, let's go further down, and you can look on it, Google it, or whatever you want to do. Okay, now look on how you apply. You apply with getting these documents right here. You had to have ID, birth certificate of yourself, your dependents, proof of residency, uh, income or a paycheck if you had it. But Who can be on it? INS, immigration. Okay. If you're from another country, an immigrant, even if you were not here legally, it didn't matter if you were or were not illegal residents or citizen of the United States, you still can get help on this Medicare program. I mean, this uh, healthcare program, which was the Go card. Okay, you got to show that proof. Now, it was originally made for Medicare and Medicaid, which you'll see right here, Medicaid letter or Medicare ID. That's what it was meant to be, but because Medicare was paying for it, it was able to help the people that did not have no income by charging, I think, a little extra to Medicare and Medicaid, I think. Okay, you have to have a Social Security award letter, TANF certification. I think that's if you're a mother and you have a newborn. I think that's what that program. I'm not sure what program that is. And a credit card and a bank statement. Okay. It didn't matter if you speak English, Spanish, Vietnamese. Matter of fact, it didn't matter what language you were eligible for it. Let me see. So you drop off the thing and then you get a notification in the mail if you've been accepted. Most times you got accepted. Now, they're not saying it's free because I think they do get money from the state to help you, but most of their money come from Medicare and Medicaid. And what they do is if you're on Medicare, Medicaid or Medicare, they kind of jack up the price, and then Medicare and Medicaid will say, okay, which would cover a little bit off, trim the fat off the immigrations and other people that can afford it. Okay. So this was before Obamacare, and this program was going smoothly. But now all the people that goes to these clinics that once was for the Go card now has to have Obamacare and have to pay premiums, which before they didn't have to do. But that's one proof that Obamacare messed up a system that was already in place that was pretty good. Everybody liked it. Now, after they found out that they had to pay for, oh, see, everybody thought Obamacare was going to be free, just like this Go Card program. Well, later when they found out it wasn't the same as the Go Card, a lot of people got upset. But this was a system that was put in place by Republicans. But the program's gone. Obamacare is in place, and Obamacare messed up everything. See, when I tell you that uh, our government messes up everything, see, Obamacare is just another hole in the cup where money just trickles out like crazy. But there was already a system in place that Obamacare totally messed up. This was already it was working. But I'll show you more here in a little bit. So we're still going in about this go-kart program, which you can find out right up here who's into it right now since they're coming into the program. But anyways, let's go to the thing. Let me see. Harris County offers a health insurance program, the Go Card, to people that meet certain residencies and income criteria. The program is funded by the taxpayers who live in Harris County. So This free Go card was paid for the taxpayer, but then again, they get money from also Medicare and Medicaid, and they get federal funding at the time and everything. But we go down here more. Let me see. Okay, right down here it says you have to please note that Harris County Go card is only available to Harris County residents, which means if anybody lives in a house, you're a resident. Furthermore, you must be a U.S. citizen or a green card holder. Green card holder, which I've seen cases where this did not matter. I've seen people that didn't have U.S. citizenship or a green card, but still got covered. Let me see. Certain income restrictions do apply. Yeah, if you're making money, there's going to be restrictions. Let me see. And let me see. Uh, someone is eligible. Someone in your family is or might be eligible for other programs such as Medicare, Medicaid. Okay, so we go down here and it talks about the CHIP program. This was a program that covers all women that's pregnant. It does not matter of their legal status, which means are they here legally or unlegally. It does not matter because uh, you still get it. But over here it says, uh, okay, you do not need a green card or legal status to qualify for the CHIP program. And this is for you get like food and some money from the state if you have a child that was born here in the United States. Let me see. You do not need to send pregnancy verification form filled out by a doctor. CHIP provides care to unborn children of pregnant women. For people that's not eligible by Medicaid. Once the child is born, they'll get benefits for the duration of the 12-month coverage period, but they still get the child after it's born. It gets on Medicaid and Medicare too. So even if you get chips, you're going to get your child's going to be on Medicare and Medicare until age 18. They the new child that comes in, the mother will get food stamps automatically. Says it's limited for 3 months, but I've seen people on that for life until the child hits 18. They also get cash payout, which I think is TANF. Now, this is Harris County is a sanctuary city, which means they cater to immigrants or people that's not here legally, and this shows you proof of it. But it also, what I'm trying to show you is people were better off before Obamacare. Obamacare totally messed up a lot of this stuff that people were getting. and it's now messed up a lot of stuff. Uh, so let's go down. Let me see. It talks about food stamps, and job training and stuff like that. Okay. Now, when someone says, "Oh, someone can't be on food stamps forever," yeah, they try to do a program where they try to get you a job in a training program, but it failed and it's not required no more. So at one time, that was true that you had to go to work or try to go to work to get on to stay on food stamps. But the program fell, and this is what took over. They just went back to the same old. Then you got emergency stamps, SNAP. You get a lot of these programs because you have a child. You have the WIC program. That's another thing where you can get cash and you also get extra income. These special, they're like food stamps, but they're a different type of food stamps. Is to buy baby formula and Pampers and all that stuff. But that's what WIC is about. That's another free thing. And it doesn't matter if you're here legally or unlegally, you still got on the system. And that's more stuff you can look up and you'll understand that I'm not telling you a lie or anything. So before someone comes up and tries to tell anybody in the log that yes, you had to be a citizen, let me go back up here. Harris County Hospital District Application 5 for physical assistance, which is by HCHD, which what we are talking about is the Go Card program. And if we go down here, let me see, immigration status, if you can read right there, you do not have to be a U.S. citizen to qualify for physical financial assistance. However, if you are a citizen and you have documents from U.S. citizen immigration status, you must present it to determine your eligibility for assistance. So you don't have to be American citizen to get it. I have never really seen anybody get turned down from this unless they get paid way too much or something at their job. Let me see. So you did not on the Go Kart program. You did not have to pay monthly things like a regular insurance. This was actually a free service, although it says it is not free. It is free. Nobody paid money, and this was better than Obamacare. This was the most affordable health care plan. Okay, let's go on. Oh yeah, let me see. Okay, let's go on charge. And that's the application. Not really too much information. And that was how you got on it. Okay, this is a new part of the Go card. It's the one after Obamacare. And what they want you to do now is to shop at Blue Cross, Anta, Cigna, Humana, and United, and they want you to get on these insurance. Okay, so they say that it was not a free thing, but it was on a sliding scale. See, sliding scale because of your income. If you got low income, you didn't. On this new one where they want you to have insurance, they do help out on that. But it also was on a sliding scale before Obamacare too. Okay, so what Trump needs to do is pass a bill where these all the insurance have to use a sliding scale based on the person's household income on how much premiums they're supposed to pay. That's what Trump needs to do is have uh, your monthly or yearly cost for your insurance, your health insurance, on a sliding scale based on your income instead of the way that the insurance companies have one flat fee, which everybody cannot afford. So if Trump would change that where these insurance company would have to use a sliding scale based on the household income, he could make Obamacare even better. But it's time to get rid of what the name Obamacare. Okay. Okay. They still have in place where you got to pay at least $5 or something when you make per visit. And some people do still pay $3 for their prescription. I think it's now up to $7 per prescription or something. I don't remember, and I haven't been there in a long time, but let me see. And this program is for low income residents. But who is also within this? Well, the police department, the Houston and Harris County Police Department, Fire Department, they go to the same hospital, the Harris County Hospital, so they get coverage there too. Okay, so that's what we had to show here. Well, you can find out more if you want to by going to Harris County Gold Card or Harris County Hospital District Gold Card or just Harris County, what is it? Hospital District, yeah. You can type in Harris County Hospital District and it'll show you the programs. So you can see that this program is still even better than Obamacare. It helps out even people that's on Obamacare, so it's a little bit more better. Okay, now I was talking about the Gold Card program, and the Gold Card program also covers dental. Yeah. So in the Harris County, if you're in Harris County and you go to Harris County, uh, what is it? Let me see. HC. We'll find out here in a minute. But there's four locations, I think. One on Fanning Street, this one on Red Bluff, and another one is Ben Taub. Oh, five of them, and LBJ. And these are people that's on Go Card. Maternity clients, children with current Medicare, Medicaid eligibility, other children with family incomes up to da da da. Okay, here it is again. You must be eligible for the Harris County Go Card, Go Card eligibility. Let me see. Exams, fillings, extractions, cleanings is cash only. Now the cash only is like I think it's like you had to pay $10 or something for for each service. Just $10. It wasn't really that much, so getting your teeth pulled for $10 was not bad. It's still like this on Obamacare, but before Obamacare, I think it was $5 for anything that went on. So let me see. Well, maybe there's more. Yeah, it looks like a little bit more, maybe. So before Obamacare, we already had the lowest income, I mean, lowest uh, affordable health care in Harris County. Before Obamacare took effect, we already had a service put in place, and it's still in place today.